Every person touched by a disaster is emotionally affected by it in some way.
People don't think about that, after a disaster has happened, you may be the most well-rounded person in the world, but the truth is it's going to affect you.
Disasters are unique and complex. Each person sees it from a different perspective and reacts emotionally in their own unique way.
Each person's trauma is different. To be able to walk up to someone and say, well, I understand how my house burned down 2 years. No, you don't. My situation is different than your situation.
So the role of mental health, also known as behavioral health professionals, is to provide for the emotional well-being of everyone involved.
So we provide the behavioral health support for two groups. One are the citizens of the area, or the residents of the area, and the second are those responders who are actively involved in the incident itself.
For the victims of a disaster, the fears and concerns are many and varied.
I think it's important to realize that everyone is different, and that in an event you can have a wide range of responses from people that are very normal given the scope of what has occurred.
Where am I going to live? I can't find my loved one. Is there going to be another tornado? Where will the kids go to school? What about food and shelter? Where's my dog? What if I get infected with the disease?
And providing mental health care for them is probably a tremendously important thing that we do, because we're preventing something bad from happening to those people many years on down the road.
The emotional considerations of emergency responders differ significantly from those of residents. Sometimes there's an attitude of toughness among responders, which can lead to underreporting symptoms of stress.
I think those of us as responders are all a little guilty of, well, I can man up and I can take it. Do I need? I don't need.
One of the things we get wrapped up in as responders is that we think, oh, well, I've got this mission to do and that's my main focus.
They recognize the really dangerous effects of chronic stress for people, both mentally, physically, interpersonally. All of those things can be impacted by it. So they recognize that and are much more open to dealing with it.
I think over the last 20 years, we've finally made inroads into convincing our responders that it's okay to seek counseling, to seek someone to talk to go through going through the debriefing, going through the de-stressing.
The earlier you can start that process and get them to start coping with their feelings, the more effective they're going to be for you as a responder. And so that's a very important piece of disasters that we really try to focus on.
Disaster mental health treatment differs drastically from traditional counseling, and it's referred to as psychological first aid. Unlike traditional counseling, disaster counseling is all about the immediacy of helping people cope at such a difficult time.
Psychological first aid is a modular approach that is available for anyone to take the training. It's been developed nationally and encompasses about 8 different kind of interventions.
Behavioral health volunteers come from many varied backgrounds and agencies. They are mental health professionals, retired nurses, or people from volunteer organizations.
Could be mental health clinicians or professionals. It could be bachelor's level individuals who have had training in disaster response.
Within the Red Cross, we also have a group of volunteers who focus around disaster mental health. And these are individuals who are specifically trained not only to help with the clients, but also the staff that are working on a disaster. And it's a wonderful program that they have, and they go around in shelters and out in the community and talk to folks.
What we need to make sure of is that their physical safety needs are taken care of first. Then we can talk to them about how are they doing emotionally.
And the first opportunity to evaluate those emotional needs is when victims arrive at the hospital.
whether that's the anxiety over whether their house is still there, or where it's the anxiety over where their family is. We are the primary people who identify those issues first for them. Then we work with our case managers, with our chaplains, with a set of volunteers that we've specifically trained to teach them how to communicate with victims or with the Red Cross.
And just as EMS employs a triage system for evaluating physical injuries, so does the hospital for emotional stress.
There's going to be fear and there's going to be anxiety throughout the whole thing. We just have to be able to be the first ones to triage which ones are the most acute in this situation and which ones are going to need additional assistance, or those that are coping fairly well at this point in time.
Once the immediate response phase of an incident is over, the real work of behavioral health professionals begins.
As soon as people start to be relocated, we're going to have a presence there with those people. For example, if it is at a Red Cross or other kind of shelter, we're likely going to have someone there to be able to help provide for those immediate mental health needs for the person.
In addition to working with victims in shelters and other organized gathering places, mental health workers often walk the streets, carrying water and other supplies.
Hey, I have these things, is there anything here that you could use that would be helpful for you? And use that as an opportunity then to engage the person in just some brief discussion about how they're doing, how are things going for them, and then be able to go on to the next person.
Sometimes a person complaining to EMS about a physical problem is actually suffering from an emotional issue. When EMS realizes the problem isn't physical, they can direct that person to mental health services.
Yeah, we interact with mental health people in COMCARE locally here on a fairly frequent basis to know their capacity. They know our role in that particular incident, so that way we can refer folks.
This type of referral system is a tremendous way to help various agencies stay focused on what they do best. Mental health services in a disaster are limited by the number of workers available, and of course, the willingness of victims to accept the help. But tending to the mental health of individuals and communities is vital because it's the one component of a disaster which can linger for years.
You meet some wonderful people and can't help but be impacted by the stories that you hear from people that are there. As I've done that, it really brings home the idea, however, that we need to be prepared for this ahead of time, because we don't want to be caught and having to make this up as we go along, to establish the relationships and have the plans in place so that we know ahead of time what the roles will be, and each person then can carry out those roles effectively.
To learn more about mental health and their response capabilities in a disaster, please refer to the resources that are provided with this video.